Welcome to Pathology Navigator. Today's topic is sickle cell anemia. Pathogenesis. It is an autosomal recessive disorder. Missense point mutation at 6th position of beta hemoglobin chain. Glutamic acid replaced by valine. Thus rechanges to HbS. Whenever there is hypoxia, sickling of RBC occurs, which regains its normal shape in presence of oxygen. Thus there are repeated cycle of sickling and desickling, due to which RBC becomes stiff, sticky, and their solubility decreases. Clinical features: abnormal RBC trapped in spleen, extravascular hemolysis leading to splenomegaly. These sticky RBC stuck in blood vessels leading to microvascular occlusion, which is responsible for dactylitis, priapism, stroke, acute chest pain. Lab tests: hemoglobin decrease, erythrocyte sedimentation rate decrease because of decreased solubility, RBC don't settle down, bilirubin increased, reticulocytes increased, peripheral smear show sickle cell. Diagnosis: osmotic fragility curve shifts to left because of rigid sickle cell. Sickling test: sodium metabisulfite produces artificial hypoxia and increased number of sickle cell is detected. HB electrophoresis, high-performance liquid chromatography. Stem cell transplantation: hydroxyurea, increased fetal hemoglobin gives symptomatic relief.